Now, you've heard it said 1,000 times that if a patient has shown a likelihood of physical harm to self or others, that's justification for taking them involuntarily to the hospital and providing treatment. But there's some other justifications that aren't as well known, and I want to talk about that for just a second here, where something is impairing their judgment, and as a result of that impairment, they are unable to obtain food, clothing, shelter, or medical care, or it is likely that they will suffer substantial injury, illness, or psychiatric deterioration unless treatment is rendered. This is what the law refers to as grave disability, where the patient has something going on that impairs their ability to care for themselves, their fundamental basic human needs. In those cases, even if they're not threatening to harm themselves or someone else, that is a justification for involuntary transport. But there are some other things here. The obvious, if they have attempted or threatened to hurt themselves or someone else, and what we're talking about there is an overt threat. And that brings us to perhaps the most pivotal point in this presentation, and that is the issue of capacity. Does the patient have the capacity, mental, legal, and situational capacity, to say yes or no to transport? Typically, providers are given very rudimentary, routine questions to ask to assess a patient's mental status. Are they awake, alert? Are they oriented to person, place, time, and event? And that's about all we get. Unfortunately, it has been shown time and time again that those questions are not sufficient for determining a patient's capacity level. So unfortunately, there's not like a cookie cutter list of questions to ask a patient to determine their mental capacity, but there are some good principles. So right now, I'm just going to give you some very basic questions that you need to seek out the answers for. And it won't always be as simple as asking them the question and waiting for an answer. You're going to have to dig a little deeper, do a little bit of investigating to get the answers to these questions. First of all, does the patient understand the information you are giving him or her? You have to go way beyond AA and O times 4 to reach that point. Does the patient understand the situation and appreciate the consequences of the decisions and actions that he's taking? In other words, does he, for example, truly comprehend that by refusing to go to the hospital, despite having clear signs and symptoms of whatever, say it's a myocardial infarction even, despite having clear signs and symptoms, they've got ST elevation on their 12 lead and so on and so forth, does he truly comprehend that by refusing to go to the hospital with you, that he could die? Is he able to communicate to you that he understands that? If he does, and he says, I still don't want to go to the hospital, guess what? You can't take him. It's his right to refuse. And the same thing goes for other patients that retain their mental capacity. So in addition to this, is the patient impaired by drugs or alcohol? Because that question always comes up. If the answer is yes, you need to scrutinize the situation even more carefully. Can someone who's drunk or high refuse care? We'll come back to that question in just a moment. And then one other thing that I want to mention here, because it comes up frequently, is what about a suicidal patient, but they are otherwise of sound mind? They can answer all questions appropriately. They don't seem like they're off their rocker. Does that patient have the capacity to refuse care? Well, they have mental capacity, but in the state of Missouri, they do not have legal or situational capacity. Think of it like this. The state of Missouri views a person who is suicidal as automatically by default lacking capacity to make their own decisions. Involuntary transport is warranted and justified.